Do you know your ABCs of emergency medicine? Well, the first two have to do with the respiratory system. A stands for checking the airway to make sure there's no obstructions, and B stands for breathing, because if a person is not breathing, they're dead. The main function of the respiratory system is to inhale the oxygen that is needed for cellular respiration, which is a chemical reaction that creates energy needed for our cells to live. The respiratory achieves this reaction by two different types of respirations: internal versus external respiration. External respiration is when the lungs inhale the oxygen from the air and expel the carbon dioxide. And internal respiration is when the oxygen from the air travels into the blood and rides through the blood highways on the red blood cells and transports to the living cells. Next, the carbon dioxide travels through the blood and expels through the lungs, because if we did not have our lungs to expel carbon dioxide, we would die of carbon dioxide poisoning, because it's very toxic to our cells.
Okay, calm down, take a deep breath, and now hold it in for about 20 minutes. Just kidding. We all breathe without realizing, but breathing is the only way to keep us alive. If we don't breathe, then the respiratory system will not be able to do its job, and we could die. There are many ways to keep the respiratory system healthy. To maintain a healthy respiratory system, you should avoid smoking, get enough sleep, eat healthy, exercise, breathe in clean air, and don't breathe in carbon dioxide.
It's very easy to cause dysfunction to the respiratory system. One of the most important ones is not smoking. Smoking causes the cilia to break down, producing excess mucus. That mucus starts to build up, and that's why people get that smoker's cough we all hear. Another big thing is pollution. Clean air is the precondition of your health. Polluted air damages alveoli, which is essential for the gas exchange of carbon dioxide and oxygen.
Pneumonia. Pneumonia is a killer, not really, but yes, really. It's an infection that develops in the lungs and has more than 30 causes. The most common cause is bacteria. When a person breathes in these pneumonia-causing germs into their lungs, their body's immune system can't prevent the injury, and the organisms settle in the alveoli and continue multiplying. As the body sends the blood cells to attack the infection, the sacs become filled with fluid and pus, causing pneumonia. Anybody is capable of getting it, really. You could even get it tomorrow. Did you know that 1,188 people die per week and 169 per day, which calculates to about 7 per hour? Crazy, right? Old people and people with chronic disease like asthma and COPD are at a higher risk of contracting it. The most common symptoms are coughing and fever, and what doctors do to get rid of it would be prescribing antibiotics, since bacteria is the most common cause. The number of days you take the antibiotics depends on your general health, how serious your pneumonia is, and what type of antibiotic you're taking. So to prevent it, just wear a spacesuit and hope it works.
Emphysema is a COPD disease caused by destruction or enlargement of air spaces like the alveoli. It's caused by smoking and pollution, and the symptoms include coughing, shortness of breath, and wheezing. The less common symptoms are fatigue and chest tightness. There's no cure for emphysema, and the damage cannot be reversed, but treatment can help further damage. Treatment includes exercise, oxygen therapy, and 35% of people die 4 years after receiving treatment for severe cases of emphysema.
Did you know that lung cancer is the leading cancer killer in men and women? Even if you knew that, I bet you didn't know there's multiple different types of lung cancer. The main cause of non-small cell lung cancer is smoking, with about 80% of all cases resulting from that. The next two most common causes are exposure to radon, which is a natural radioactive gas, and exposures to asbestos fibers. Asbestos causes lung cancer because the fibers lodge in the walls of the lungs and cause damage. The symptoms of lung cancer include hoarseness of voice, chronic cough, chest pain while breathing, loss of appetite, and weight loss. The treatments of non-small cell lung cancer include chemotherapy, surgery, and targeted therapy. But chemotherapy is the use of drugs to kill off cancerous cells, but they also kill off normal healthy cells. Surgery can be used to remove the infected tissue or even remove a whole lung that's infected. And targeted therapy is a relatively new discovery, and it targets cancerous cells and kills them off, but it's still in the works of being worked on.
There are no exact causes for asthma, but researchers believe that some genetic and environmental factors interact to cause asthma. Some of these factors include parents who had asthma, a certain infection from childhood, or any contact with airborne allergens or exposure to infections when the immune system is developing. Some common symptoms of asthma are coughing, wheezing, chest tightness, and shortness of breath. Unfortunately, there is no cure, but asthma could be managed and prevented by rescue inhalers. About 24 million Americans have asthma, and there are about 2 million emergency rooms visits each year.
Cystic fibrosis is a genetic mutation that only happens a couple times within every birth. There are about 1,000 new cases each year in the United States, and about half the population is over 18 years old. Symptoms vary very widely, but the most repeated symptom is a lot of lung infections that don't go away easily. Since it's genetic, there is no cure or prevention. Babies are usually tested a couple weeks after they're born, and if they show symptoms, they're immediately placed on some type of treatment to prevent any infection. The smallest lung infection can cause really big backlashes for those who are infected with CF.
In conclusion, the respiratory system is a vital system. Gas exchange is how the respiratory system helps maintain homeostasis. However, many disorders such as asthma, cystic fibrosis, lung cancer, pneumonia, and emphysema can affect this vital function. Remember, kids, life without breath is death. Don't forget to breathe.